Okay, welcome everyone. If you could settle down. Before I introduce today's speaker in our seminar series, there's a few new faces here. Just to mention, these seminars occur every Friday on a whole range of topics around nature, every Friday in and around term time. So if you're not aware of them, just go to the Oxford Biodiversity Network website and you can see the whole list of seminars that are there. Before I introduce today's speaker, I just want to mention the next few weeks of seminars that we have. Next week, we have Dan Nepstad talking about the Amazon forest climate solution. The week after, we have Melissa Leach, who's director of the Cambridge Conservation Initiative and the former director of the Institute of Development Studies, talking about reflections on conservation justice in West Africa's forests and beyond. And the week after, we have Andy Gonzalez, who's director of the Global Biodiversity Observation Network. They'll be talking about biodiversity data to support the global biodiversity framework. And there's a whole range of talks beyond that as well until the end of term. And so it gives me great pleasure to introduce Professor Ben Wheeler, who is Professor in Environment, Health and Inequalities at Exeter University at the European Centre for Environment and Human Health. And he's a health geographer and environmental epidemiologist. And we were talking to him earlier, seems to be quite a itinerant researcher that's interested in linking across many sections of academic research around nature and public health. So thanks for joining us, Ben, and over to you.
Thanks, Edmund. Hi, everybody. Thanks very much for the invite to be here today. That's great. I'm going to talk about nature, health and well-being today, around the kind of evidence that we've got, but also the action that's going on or potentially could go on alongside that. I'm based at the European Centre for Environment and Human Health. We're a research centre of Exeter Medical School, but actually based down on the Cornwall campus, down in Falmouth. And it's a very nice place to be, but always nice to get out of Cornwall as well, and come up to England, like we say down there. And I'm also co-director of the WHO Collaborating Centre on Natural Environments and Health, and that's a really great vehicle for us to be involved in these kinds of issues around nature and health and well-being at that kind of particularly WHO European region kind of scale. So I'm going to talk around a lot of different things today. It's sort of a bit of a whistle-stop tour across a lot of different ideas, bits of evidence and so on. The kinds of things I'm going to cover are around natural environments for health and well-being generally, nature-based solutions, policy interventions, particularly connecting nature health kind of agendas within what's been framed as the triple crisis of climate change, biodiversity loss and pollution. And a little bit as well about avoiding unintended consequences, because a lot of the stuff that I'm talking about today and the kinds of things that nature and health is often framed by is typically kind of the benefits for health and well-being, which is great. And it's really nice as an environment and health person to talk about the positive relationships, but also inevitably there are potentially some adverse impacts and some unintended consequences that we need to grapple with. So this is a way of thinking about these connections between nature and health and well-being. There are lots of other ways to think about it too. But being an epidemiologist, I like to think about exposures and outcomes. So we start with our exposure to the natural environment there in the box on the left. And the natural environment is clearly a highly complex kind of set of stuff, whether it's green spaces or living near the coast or having trees in your neighborhood or having a private domestic garden, all different kinds of nature that we might have around us. And then there's kind of how we contact that nature, whether we're actually in it, whether we are looking at it out of the window, whether we're passing through it in a kind of unintentional fashion on our commute to work. Lots of different ways in which we might actually be exposed to that kind of natural environment in some kind of way. And then on the way to impacts on health and well-being, a whole range of what have been framed as salutogenic mechanisms. And if you've not come across that before, I really like it. It's a nice term. It's kind of the opposite of pathogenic. So pathogenic, disease-causing, salutogenic, health-promoting, health-causing, if you like. And we'll come across some of these kind of mechanisms in the time that I'm talking this afternoon. But of course, that relationship doesn't happen in a vacuum. It happens differently in urban and rural environments. I was having a good discussion with folks this afternoon, and a lot of different things happening in urban and rural environments relating to nature and how we react to it. Lots of potential for confounding. So if anybody's into environmental epidemiology, we're typically kind of really obsessed with confounding, and typically most of our studies we sort of say, well, it might just be residual confounding. So really strong relationships between the nature in our areas and socioeconomic status. And then we've got all this other stuff going on as well. So I'm not going to go through it all, but clearly all of our relationships with the natural world happen in complicated social, ecological, economic contexts. And we have to kind of be aware of that. And I think if we just assume we're just concerned with the middle line of that and just the exposure to outcome relationships, then we're missing a bit of a trick, even though that's also really important for us to think about. So it's complicated. As scientists and social scientists, we're always very guilty of saying, well, it's really complicated, but everything's complicated, right? And so in my mind, the way we deal with complicated is to carry out interdisciplinary research and to take these kinds of questions about the connections between the natural world and human health and well-being and come at it from a lot of different angles, whether it's lab experiments or social science studies or large-scale data analysis or economics. Whatever it is, we need all these different kinds of approaches to really get to grips with it. So just to start off with a bit of evidence. So let's just think about living near green space and mental health and well-being, probably one of the best studied sort of facets, I suppose, of nature, health and well-being. This is one of the first studies that I was involved with. We started the European Centre in 2010, and fairly soon after that started working with the British Household Panel Survey, incredibly valuable longitudinal data set. Now kind of has become Understanding Society. People might be familiar with that one, as well as BHPS. But 18 years worth of data following 10,000 people, annual questions going to them. And so for each of those 18 years, we know for our 10,000 people where they live. We know their self-reported mental health and well-being at each kind of wave of data collection. And then we can geographically link them with their environmental data based on their home location at each wave. It's not perfect. It's kind of a bit messy. We're assuming that the greenness in their neighborhood is a good representation of the greenness that they're exposed to, as we do in lots of studies, but it's one way of doing it. And really, we're asking a fairly simple question of this fairly complicated data set. And we're just saying, do people report better mental health in the years when they live in greener urban areas? And perhaps unsurprisingly, but kind of reassuringly, the answer is yes. This was one of the first opportunities we'd had to do a really substantial longitudinal study. Prior to this, a lot of studies had been cross-sectional, with all the kind of challenges that come with that. But yeah, this is a nice, robust opportunity to study these relationships. And one of the bits of the analysis enabled us to look at, okay, amongst all of those people over those 18 years who had moved to a greener urban area, so in this case, we're ignoring the rural, this is just about urban areas. When somebody moves to a greener area, what happens to their self-reported mental health? And in this case, we've got 2 years of data prior to the move and 3 years of data after the move. And that suggested that people's self-reported mental health improved after they'd moved. And importantly, it stayed improved for at least 3 years after they'd moved. So this wasn't, or at least it didn't seem to be, a blip. So often when something happens in our lives, if you win the lottery or something, typically you might experience a boost to your well-being. But quite often you will then go back to a baseline. You'll bounce back to where you were at the start. But in this case, that didn't seem to be happening, at least amongst this sample of people. So that's living near greener urban areas or living amongst greener urban areas. But what about actual visits to nature? What about spending time intentionally going out there and spending time in nature? And by visits to nature, in this case, this is referring to any kind of nature. It doesn't necessarily mean this kind of opportunity to go for a nice walk in the Brecon Beacons. This could be going to the park in your neighbourhood, or perhaps going for a walk along a footpath in a rural area. Say any kind of visit to nature is included in this definition. And so this is a study based in Wales, where we were able to look at nature visits and well-being. And so we're asking a couple of questions of this survey data. So again, this is all self-reported data. But in this case, the National Survey for Wales asked people to report on their time spent in nature. And so we ask, is that associated with better subjective well-being? And then trying to make the connection with social inequalities. And in this case, kind of picking up on a suggestion of equigenesis, the creation of equality, a term that's been around for a while, but applied in this case by Rich Mitchell and colleagues up in Glasgow, trying to say, okay, well, if we know there are really significant links between, say, socioeconomic status and health outcomes, is the opportunity to live amongst a good quality living environment potentially a bit of a buffer? Does that provide a bit of a break between that conversion of, putting it crudely, poverty into poor health? So this equigenesis idea has been shown in a few different studies now, and suggested in various different ways. And so we investigated that as well. When we look at weekly time in nature, like I say, it's from the National Survey for Wales, self-reported weekly time in nature, and then self-reported subjective well-being. This is the graph of the distribution of that estimated outdoor leisure time on visits to nature. And you'll see, I mean, we've kind of lumped this together. So the left-hand bar is 0, so quite a lot of people reporting 0 time at all in visits to nature, even going to a park or those types of perhaps everyday type visits that we might think of. And then as we go up, the sort of the amount of time declining, and then we have this big chunk of people in our top bar, which is effectively an hour or more a day, every day across the week. And we can't investigate that using this data set, but I'm pretty certain this is what we're talking about. So there's a whole group of people, you know, a huge proportion of visits to nature are people walking their dog. Perhaps I can't remember what the proportions are, but a pretty significant proportion of the population have a dog, and lots of those people go out and take it for a walk. There's probably something a bit different about taking your dog for a walk compared to going for a different kind of visit to nature, just because sometimes for some people it's kind of, you've got to do it, right? You've got to take the dog out. So perhaps there's something different going on there. But anyway, it's an interesting sort of variable of time in nature that's probably capturing some different kinds of activities. But anyway, what happens when we look at that and we compare it to people's self-reported well-being? Well, first of all, we see that more time in nature is associated with better well-being, so it goes in the direction that we would hypothesize. But also we do at least see a bit of evidence of this equigenesis hypothesis. So perhaps with that well-being gap between those in material deprivation versus those not in material deprivation, and this is a standard Welsh Government definition, there's a big gap between those two groups across the board, but that gap seems to be much bigger amongst people who don't spend time in nature. So some sort of suggestion of support for that hypothesis that perhaps having the opportunity to engage in natural environments, to make those visits, might at least to some degree start to buffer those impacts of socioeconomic deprivation. Some similar data, in fact, this is the kind of the original data, really. The Welsh survey questions are really based on this survey. Some of you might have come across this if you research in this area, the monitor of engagement with the natural environment. Certainly for the 10 years that the Meany was running, it was pretty much unique internationally. There wasn't really a similar kind of survey anywhere. There's now increasingly surveys that are similar in other places. And I guess there's been related surveys carried out, sort of recreational opportunity, tourism type surveys and things. But this survey data is amazing. It changed in early 2020, which was really unfortunate timing, because we had a massive change in the way this data is collected at the same time as other interesting things were happening. And so we've got a real discontinuity in this data set. But for the 10 years of the Meany, from 2010, we've got a fantastic data set on getting on for 450,000 people that talks about who are they, where do they go on their visits to nature, who do they go with, what are they doing, And you can see there, top activities undertaking. Basically, most of these nature visits are going for a walk, either with a dog or without a dog. But lots of other things that are really important as well, like playing with kids or even eating and drinking out. So it captures a lot of different kinds of visits to nature. And it's hugely valuable because it tells us about that time spent visiting nature and lots of other stuff as well. And again, we're able to look at, in this case, self-reported health. So in this study, what we were able to do is very similar to the Welsh study, really. Take the time spent visiting natural environments in the last 7 days and see how that relates to people's self-reported general health. So a really general kind of health status, but actually a really good question. I think you may well have seen it if you filled in the census form in the UK. It asks a question, something like, how is your health in general? And you rate it on a score from 1 to 5, from very good to very bad. It's incredibly powerful. It's really, really strongly associated with more objective health outcomes. But basically, we see this kind of pattern of time spent on nature visits and self-reported health. There seems to be a bit of a ceiling effect. So once we get above whatever that is, somewhere around 4 hours a week, there doesn't seem to be much of an additional benefit. And actually, in terms of seeing sort of substantive evidence of a difference compared to 0, we start to see that at about 2 hours a week. And this doesn't include physical activity, or we've accounted for physical activity in this. So we would expect to see a relationship between time spent doing physical activity and health outcomes as well, incredibly well established. But this benefit seems to come about even if you're just going to a park and sitting on a bench. You don't have to be, a marathon runner to be getting this benefit, at least according to this study. As with the Welsh study, subject to lots of caveats, it's based on cross-sectional data. So we don't know, exactly which way round things are going. But based on other studies, we're pretty sure that it's not just reverse causality. It's not just that people who are healthier tend to go out more. There may be a bit of that going on. We can also use that data to start getting into the economics. And I know, talking to some folks this afternoon, there's a lot of folks doing economics around these kinds of questions here. And it's not totally my field, but we were able to take this data, in this case, specifically around recreational physical activity during these visits to nature, and demonstrate that they're worth somewhere around £2 billion to public health in England, based on this kind of the physical activity that people get during their visits to nature. So when you compare it to the sort of size of the NHS budget or whatever, it's not a massive amount of money, but it's not trivial as well. And especially when you look at the amount of money it costs to actually look after neighbourhood parks and so on, £2 billion, if we're doing a really simple kind of cost benefit analysis, starts to buy you a lot of environmental protection and environmental improvement. So interesting to start turning this into pounds. Similar work that was just quite generically on sort of the health benefits of physical activity. Colleague James Grelier led this study on nature-based physical activity and disease prevention, in this case looking at 6 of the most common non-communicable diseases, and able to demonstrate that based on the same data, so the MENI data for 2019, we had somewhere around 22 million adults in England visiting natural environments at least weekly, and their physical activity on those visits estimated to prevent somewhere around 12 or 13,000 cases of those diseases. And the societal costs of disease avoided using standard kind of economic methods, as far as I understand them, estimated at somewhere over £100 million. So not kind of massive in the grand scheme of things in the terms of public health in the UK, but also not trivial. When we start talking a bit more broadly about the health economic value of nature and biodiversity for people, clearly this is fraught with an awful lot of contention. We can have big arguments around intrinsic value and whether it's appropriate to measure this kind of this economic financial value of nature. But clearly there are a whole load of benefits that are being provided by a whole range of ecosystem services that relate to health. And biodiversity, a fairly fundamental underpinning to a lot of those ecosystem services. And so most of what I'm talking about today is really related to those kind of fairly straightforward mechanisms, perhaps around psychological well-being, around mental health, around physical activity. But there's clearly a whole load of other stuff that's absolutely fundamental as well in terms of how nature and biodiversity support and promote human health and well-being, whether it's having healthy soils and healthy agricultural systems that provide food security, to environments that are not sources of significant infectious disease, and everything else in between. So a really complex array of stuff going on, and we have to recognize that. But again, thinking about the economics, I was really fascinated. Dasgupta review, huge review commissioned by the Treasury, really, really incredible opportunity to actually explore the economics of biodiversity, reported in 2021. And even just a few years ago, was still basically saying accounting values of natural capital do not adequately include the health benefits a less degraded nature confers on us. They're even farther away from being able to include the benefits to our mental health that green spaces confer on us. So really interesting. A lot of the stuff that I'm sort of talking about today, suggests we've got quite a lot of evidence around this. But I'll show you something later on that will suggest maybe we don't have as much as we think we do. But also, obviously, monetary economic value is not the be all and end all. And amongst this report for the WHO, it was really clear that these other modes of valuation are really important in terms of this way that benefits are often expressed in physical or monetary terms, but they don't always capture the ways that people perceive, measure, and value nature. And of course, when you go and talk to people about what matters to them, about the nature in their neighborhoods and so on, a lot of the things that people would talk about aren't necessarily things that are easily sort of tangibly valuable in a monetary kind of sense. Okay, I'm going to finish on economics. I'm going to talk for a little bit about coastal environments as a very specific kind of natural environment, very significant for the UK, very significant around the world. Our coasts are incredible centres of population. Typically, a huge proportion of the world's population lives near a coast. What I'm talking about here is particularly the UK coast, and circumstances are going to be wildly different in different international contexts. So I do recognise that. But we've done a whole load of research around coastal blue space and health and well-being, and I'll show you some of that in a moment. But it was really interesting. In 2021, Chris Whitty had commissioned work on health in coastal communities for the annual report of the Chief Medical Officer. And actually, most of that report, probably 80 to 90% of that report, is flagging up the challenges for public health in our coastal communities. Kind of simplistic, but the map on the front cover of the report there showing the prevalence of coronary heart disease, and perhaps it's more complicated than a coastal effect, but there's probably something going on there. And similarly with data we've looked at from the census, if you simply plot that census data on the map, looking at people's self-reported general health, you find this coastal effect where actually health is typically worse in our coastal communities. And of course, this is where all those complexities come in terms of the connections between the physical environments that people live in, but also all the other things that drive people's health at an individual, but also at a community population scale. And all of the things that are highlighted in that 2021 Coastal Communities report, socioeconomic deprivation, migration, demography, economy and employment, all of those things are really standard kind of wider determinants, wider drivers of population health, as depicted in the Barton and Grant map there, of all these different kinds of facets of our lives that drive our health and well-being. So perhaps it's not surprising when we think about coastal communities that we see these patterns, that health is worse. We typically in coastal environments have poor housing, poor economic situations, poor opportunities for employment and education, all sorts of other stuff going on, driving population health. But the report did at least kind of acknowledge that despite all of those health challenges, coastal areas perhaps might be generally intrinsically healthier places to be. And that's something that we've tapped into, we've been working on for quite a while, around health promotion at the coast. And I say we've been working on it for a while, people have been working on it for a lot longer than we have, and people have been thinking about this for hundreds, if not thousands of years. But there's really nice couple of papers from the Lancet in the 1930s by a Dr. Fortescue Fox. But even this building on the work of Dr. Richard Russell of London from the 18th century, around that kind of value of coastal environments, in this case for convalescence, for health promotion amongst people. And again, you know, in a world where we didn't necessarily understand how this was working or what was working. But even at this time, you know, we had Margate Sea Bathing Hospital. We had these kind of literally hospitals at the coast that were trying to take advantage of perhaps what has been considered to be a healthy environment. But bringing this back up to date, when we look at the 2001 census data, actually after we'd accounted for the fact, even in this case quite simply, for the fact that coastal populations are older and more socioeconomically deprived, they were healthier than we would expect them to be compared to similar communities that are more inland. So even at this really coarse sort of population scale, actually able to see something going on. And so we have done all sorts of research to go with that. And again, looking at this equigenesis effect, in this case, dividing the population up into 5 from the most to the least deprived. And actually seeing that we only saw this positive association between coastal proximity and good health amongst the more deprived sections of the population. And in the least deprived quintile, the right-hand chunk of the graph, we don't really see any relationship at all. And there's all sorts of reasons why that might be, but it's possible that this equigenesis thing there might be something in there about the fact that your immediate environment might be more important for your health if you don't have the resources and the capacity and the time to spend time outside of that environment. Perhaps what's immediately around you might be more important. Obviously, we can't tell that with these data at all. So again, using these kinds of data, we start thinking in a slightly more complex way and thinking about, well, okay, how does it actually work? This is all very well with this big picture census data or wherever the data is coming from. But just thinking about, well, what are the mechanisms by which the coastal environments might be beneficial for health? And really, they're very similar to the sorts of the diagram that I showed you right at the start in terms of the different ways that people experience coastal environments, opportunities for physical activity, opportunities for rest and restorative kind of experiences. So acknowledging that these pathways are complex, and we have various bits of evidence to back up at least some of those pathways. So again, a study using the British Household Panel Survey, that sort of longitudinal 18 years worth of data, basically doing the same kind of study as we did for green space, but this time looking at living near the coast. And basically using this data, we're able to show that folks moving towards more coastal areas would report better mental health. So this is a within individual kind of study. We're looking at the same individuals when they live further away and closer to the sea. And because of the power of this kind of data that tells us all sorts of other things about those people, you know, what are they doing for a job? What relationship are they in? Have they got kids? So, you know, all the other stuff about their lives, we're able to eliminate things like the healthy retiree effect. This isn't just people who are older and healthier being able to move towards the sea. And again, that kind of reverse causality effect. So using these data, we're able to demonstrate at least it's probably not that going on to any great extent. Okay, at least a little bit of international data here, moving us outside of the UK. Took the opportunity of the Blue Health Project, Horizons 2020 European project, to conduct a similar study to the MENI, but actually just focused primarily on blue space, around 16,000 adults around the world, still very much situated in the global north, but looking at these kinds of relationships and seeing them replicated. So when people take more visits to the coast, reporting better mental health. Also seeing this in physical activity, again, back to the MENI here. So again, a large cross-sectional sample of the population in England, and demonstrating that, at least based on a fairly simplistic self-reported physical activity metric, people living closer to the coast more likely to report more physical activity. The interesting thing that I haven't got in this slide is that we broke this down by region across the country, and actually this pattern only really holds in the southwest and northwest of England. We didn't see the same thing happening in the east of England. Don't know why that is, just really interesting. Stuff that we haven't really got back to yet, I don't think, despite having done this study some time ago. And I just wanted to fly the flag a little bit for some qualitative research. It's not my specialism, but I've worked on various projects that apply increasingly mixed methodologies, but also just straight up qualitative research methods. This work done by my colleague Sarah Bell, asking people about, what characteristics of their neighborhood made them feel happy and well. So it's sort of quite an open-ended thing, but lots of people, obviously we're based down in Cornwall, lots of people talking about the importance of the coast. And in this case, capturing some elements of the importance of social encounters, of opportunities to spend time with other people, whether it's friends, family, and so on. So I guess a little bit of a richer insight into what's going on. Here I'm going to go back to that triple crisis thing, thinking about how these things all connect to each other. Clearly, we've got a lot going on at the coast, not only socioeconomically, not only in terms of people's opportunities for restorative visits to the coast, but also with climate change, increasingly important coastal flooding, extreme weather events. A lot of other stuff is likely to be exacerbated as well. So, for example, poor housing quality, really significant problems with damp in most coastal areas, and all these other things as well, fragile employment opportunities, potential impacts of climate change on tourism, potentially impacting those employment prospects for people in those areas. So a lot going on here where we're starting to tie together what's going on in the characteristics of the physical environment, how that's changing under climate change, and the socioeconomic kind of circumstances of these places. I'm going to talk briefly about mitigation of environmental hazards. This is one of the kind of potential salutogenic mechanisms that I mentioned at the start. Here's a study led by my colleague Joe Garrett, where we're looking at mitigation of environmental hazards. I think the green space has got a little bit covered up there by the logo. But basically trying to say, okay, what's the value of urban green space in protection from heat? We know that greener urban areas are typically more cooler in hot periods compared to more built environments. And so what's the potential health gain from that kind of greenness? So using this kind of methodology with very detailed remote sensing based temperature data for the Paris region, and also green space data, Joe's able to model, okay, so we know that, immediately within a green space, it's cooler, and that cooling effect has a bit of a halo effect as well. So using that data, able to show how far out from the green space does it go. And then combining that with extremely high resolution population data. For Paris, it's great. They have population per building data, which is really amazing for this kind of work. Therefore able to calculate how many people were affected by that cooling, what's the difference in temperature they're experiencing, combining it with some bespoke local temperature mortality relationships. So that curve on the bottom left there is different. It's different in different cities within France. It's different in different countries. But we're able to relate that temperature mortality curve to the cooling effect of the parks, and then relate that to numbers of deaths prevented, and to turn that into an economic value using the fairly standard value of a statistical life approach. And again, something we can argue about, but arguably useful. What does it look like? Through the hot periods of 2019, an estimated 40-ish deaths prevented. Less than half of the population of Paris found to be benefiting from this green space cooling. So clearly a substantial inequality, even just within the city, of who's able to get this benefit. Perhaps unsurprisingly, larger spaces cooled a greater area, but also interestingly, smaller spaces might have a higher value per unit area, perhaps because they're smaller, there's a greater population immediately around them getting that benefit. So that starts to speak to those ideas of, okay, how do we plan places? How do we plan our environment in a way that in this case might be most beneficial for urban cooling? And obviously we can put that on a map and effectively tie a mortality-based economic value to each of those parks in the Paris region. Interesting stuff, and great to be able to actually start to attach this sort of mitigation-based health value, which obviously doesn't depend on people using it. We don't have to depend here on somebody going to the park to get that that value, this is just going to happen to people. It's based on their residences, not based on their visits. I said I'd briefly talk about unintended consequences and adverse outcomes. Really important for us to recognize this. If nature was a tablet, it wouldn't be able to go on the market without some serious research about it, about unintended consequences, about adverse impacts. All sorts of things. Vector-borne disease, risk of injury. Maybe it doesn't work for anyone. Maybe it doesn't work for everyone. A real risk for those of us working in the field. If we overstate the case for health benefit, perhaps we can kind of do more damage than good. So we have to be careful about framing it as a sort of a silver bullet for everything. Potentially, there might be adverse outcomes of nature on prescription, just like for any other kind of prescription. And really importantly, and this is often missed, I think, from the nature health kind of discussion, is actually, are there potentially adverse environmental impacts of interventions that are capitalizing on this nature health relationship? Something we really have to think about. I'm just going to talk very briefly about one of those, about vector-borne disease. This is work done by Kaylee Hansford at UK Health Security Agency. And so this was based on a review demonstrating the prevalence of ticks in urban green spaces. So we often think about ticks as being purely a rural problem. If you're hiking up in Scotland or up in a hill somewhere, if you're out on heathland, increasingly we're finding ticks in urban green spaces, most likely some climate change things going on with that, as well as land use changes and other things as well. But definitely in this case, across Europe, variable prevalence, but definitely finding ticks in urban green spaces. And then interestingly, when we start to think about things like nature recovery, nature restoration programs, this study found of 3 cities in England, found that connectivity between urban green space patches was a key driver of tick presence and density within that urban green space. So really starting to think here about, okay, well, we think there are potentially some massive benefits in all sorts of ways of connecting up our wildlife corridors and so on in urban environments, but we don't get to be selective about the wildlife that uses those corridors, right? So maybe there's stuff that we have to think about here. It's really important that we don't throw out the baby with the bathwater, and on the whole, we're really bad at dealing with risks. And so this is the kind of thing that absolutely has found its way into local newspapers in saying, you know, oh, the council aren't mowing the park anymore, everybody's going to get Lyme disease. So we need to kind of be cautious and reasonable about how we communicate this. So thinking about that, how do we actually turn all this evidence into something useful? How do we turn it into evidence-informed policy and intervention? I guess starting at the top, or at least at a large scale, many of you be aware, every 5 or 6 years, we have this ministerial meeting of health and environment. So all of the health and environmental ministers from the WHO European region, so 53 countries and territories, have a get together, think about what's important in environment and health. This is the one from 2023 from Budapest. For the first time, I mean, green space has been in these declarations since 2010, so that's the first time it appeared. Still making that case here, but critically here, making that case for the triple crisis and saying from a public health point of view, we have to see climate change, environmental pollution and biodiversity loss as being interconnected and things that we have to deal with all at the same time. There's no point in thinking about them independently from each other. Really, really powerful. And that will set an agenda for coming years. Zooming back into the national a bit, this is work led by my colleague Becca Lovell, who had a fellowship with DEFRA, did lots of work around the evidence for nature and health, probably coming on for 10 years ago now. That kind of work, and amongst other things, led through into the 25-year plan for the environment from 2018, 2019. And a direct consequence of that 25-year plan for the environment was the green social prescribing test and learn sites. So initially, a program of 7 test and learn sites is now being expanded, basically working between DEFRA and NHS England and other partners to basically see how does nature-based social prescribing work. And actually, even though the evaluation was able to do stuff like this, sort of before and after studies of these nature-based interventions for people and demonstrating that typically people report better well-being after a nature-based social prescribing kind of intervention. Actually, some of the really important stuff in their reporting and in the evaluation of that is about the system. Clearly, certainly here in the UK, the NHS is a completely fundamental thing to our offer of health services. So really important that we understand how that system works. And it turns out, unsurprisingly, it's incredibly complicated. And getting nature on prescription to work is never going to be as simple as getting a GP a button that says, drugs or nature. It's just not going to be that sort of straightforward. It's a very complex kind of set of stuff going on, but really powerful and really important that it's being done. More broadly, zooming back out a bit again, this is another European research project starting to kind of think about the mechanisms again. And we've been talking a bit about that this afternoon, the importance of understanding, breaking down the black box in the middle of all this, thinking about how does this stuff actually work? One possible sort of mechanism in terms of mental health improvement through nature-based therapy is what's been framed as biopsychosocial resilience. And there's a theoretical paper there that you can read if you're interested in it, but basically trying to break this down a bit and saying what's actually going on in one of these interventions, just like we'd have to do with a new pharmaceutical medication. How's it actually working? What's actually going on for people? Now zooming into the local, I wanted to talk a bit about local nature recovery strategies, and I'm sure that I'm aware that the Leverhulme Centre has a huge amount of work going on that there. So there are folks here who know an awful lot more than I do about local nature recovery strategies. But we've been working with Public Health Dorset for a long time on sort of green space accessibility and so on. And the statutory guidance for local nature recovery strategies says, yes, the priorities have to be species and habitats. That's what it's all about. But given the potential for health and well-being benefits of access to nature, LNRSs can take that into account, can include that in their work and propose potential actions. So based on that, we've been doing some work with Public Health Dorset, in this case, mapping the population that lives within 300 meters of a natural green or blue space. We can argue what natural means in this case. And again, here we start to see that urban-rural thing really importantly. So when we're just mapping access to green or blue spaces, so defined, actually most of the sort of the best access is in the urban areas. If you're not familiar with the area, that bottom right-hand corner is Bournemouth, Christchurch and Poole, the sort of the more urban local authority. And then most of the rest of it is quite rural Dorset, which, at least from this point of view, seems to have really bad access to nature. But of course, in rural areas, perhaps one of the most important things is public rights of way, footpaths and so on, that enable people to spend time in natural environments, even if they're not going to a park. And so we can map the public rights of way, and we can actually do a more rurally focused version of that green space access. So here we've got the percentage of the population within 300 meters walk of a green public right of way. And so now we start to get a bit more of a balanced view of both urban and rural access to nature. In terms of informing the local nature recovery strategy, how might it be useful? Well, we might be able to start to feed this in, thinking about, okay, well, if we can overlay areas that are high opportunity nature areas for the LNRS with accessibility mapping, where might interventions be able to deliver on both fronts? But perhaps also really importantly, where might we be able to say, do you know what, accessibility is fine here. We don't need to do access measures here, or actually access in this area might be more damaging and disrupting to the environment than it's worth. So starting to disentangle that a little bit would be important. I'm going to talk again here about inequalities. Who doesn't visit nature? Again, going back to our friend the Meany survey data. Again, a lot of this stuff isn't rocket science. A lot of it is probably stuff that we would instinctively feel like, but actually you see it coming through in the data. So people who are infrequent visitors to nature, so less than once per month, in fact, most of those folks are people who don't go at all. They're more likely to be female, to be older, to be in poor health, to be of lower socioeconomic status, to be from an ethnic minority group, to live in a relatively deprived area, and to live in an area with less green space. So unsurprising, but also really important to see it playing out in the data about who doesn't visit nature. And what's really interesting is when you ask them why not. What are the reasons people give for not visiting nature more? And actually, for the vast majority of people, it's literally time. I'm too busy at work, I'm too busy at home. That captures most of people's reasons. But also things like they're already in poor health, or the weather's too bad, I think the no particular reason group is really interesting when we think about interventions that might want to support people to engage with nature. Perhaps people who have no particular reason, it's literally not on their radar, they haven't even thought about it. That might be an interesting way to target. But I guess the key point from this is if we're just changing the environment, that's unlikely to be sufficient to increase access by itself. We need to start doing social interventions as well. And people have demonstrated this pretty well through studies. And we've seen the same through sort of physical activity research over the years. You get the best bang for your buck if you're changing the environment to be more amenable, but also supporting people, providing educational opportunities, promotional interventions, and so on. Back to unintended consequences. Sometimes things don't work out like the way we'd like them to. People might be familiar with this example. There are other ones of kind of vigilante mowers, as they were put. You know, people didn't want the grass in their park to be left long for meadow management, so they just went out and mowed it themselves. All right, fair enough. That you know, citing lots of concerns about dogs, ticks, other sorts of things. So the point about this, I think, and it's not the only solution to it, but one thing that's really important with these kinds of interventions is that you take people with you. And lots of stuff has been done around public participation in decision making generally, but also in green space decision making specifically. The photograph there is some colleagues on the Regreen project had this, you know, really nice sort of large scale map printing thing where they take this huge 5 by 5 meter map of the local environment around, and people could walk around their neighborhood looking at the green space and actually talking about, you know, the places that were important to them and how they might like to see it changed. So a really important part of the process. Okay, I'm going to finish up with some gaps in what we don't know and then tell you a few things that we're doing to try and at least start filling some of those gaps. So we don't know a massive amount about what matters about the qualities and characteristics of blue spaces. We know a lot more now than we did, say, even 5 years ago, but we need to do more on that, including biodiversity. It's really unclear, I think, the relationship between biodiversity itself and health and well-being, at least in terms of this kind of research. Proximity is really complex. Does it really matter how nearby your nature is? Who does proximity matter for? I'm a geographer, so I deal in proximity all the time, but I have to accept that it's not all about proximity. Inequalities, we're likely to have a balance of both positive and negative effects on health inequalities with this stuff. We're going to have to be making trade-offs between the multiple benefits, but also the potential risks of intervening policies, whatever it is that we're doing. We need to understand what works for who in what context. Anybody who's familiar with realist research will be familiar with those questions. But with these kind of interventions, that's what, you know, we really need to understand the complexity of this, even just something as simple as what works for urban versus rural populations. And in some circumstances, our traditional way of understanding whether an intervention works or not, like a before and after controlled intervention study, that might not work. For some things it will, for other things it won't. How much evidence do we need? Okay, so this is great, right? This is, you know, the last 10 years or so. This is PubMed, so health-based academic journal publications, really sort of extremely numpty kind of bit of analysis here, searching for green space evidence. You know, it's grown massively, especially in the last 10, 15, 20 years. So we've got loads of evidence, right? But that's what happens when you put it up against air pollution. And, you know, we've been working on air pollution for decades and decades, tons and tons and tons of evidence out there. And we know how hard that is to deal with. We're still really struggling to have really effective policies and interventions to tackle air pollution. So to my mind, it's kind of unsurprising that we don't really have a huge amount of traction yet with the green space and health research agenda making those impacts, but it is having impacts. So I said I'd wrap up on work in progress, a few little things that we're on the way with. Colleagues have been working with the Blue Health survey data to look at wild swimming. The question that everybody asked us during the Blue Health project is wild swimming good for people? Is it better than swimming in a pool? So here's a study using that survey data to try and answer that question. Really interesting work in progress. Of course, going back to triple crisis, we have to think about the context that wild swimming's happening in, not only in the UK, but around the world. Interesting times. That question about equigenesis at the coast, I showed you data from the 2001 census where we suggested there might be an equigenic effect happening. Preliminary analysis of the 2021 census data suggests it's not there anymore. We need to do some more work with this. Clearly, our socioeconomic context has changed massively in the last 20 years or so. Perhaps there's just not enough positive now to outweigh the negatives. Don't know. We need to do some more on that. Public involvement. Colleagues in the Groundswell project are working on, in this case, a realistic review around those questions around public involvement. How do we do good community involved decision making in terms of urban green and blue spaces? Really, really important if we're to actually intervene, especially in urban areas, in a way where we can take the public with us and we can take communities with us. And then lastly, that big question, tackling health inequalities through green and blue infrastructure. Can we do it? We kind of know this works. If we intervene in the environment, we can change the green and blue infrastructure. We can have an impact on population health. We don't really know what the impacts on inequalities might be. We know there might be co-benefits. How do we really capitalize on them? All of these kinds of things going on. Green infrastructure framework, national planning policy framework is going to be clearly very huge in terms of shaping the environment that we live in coming years. Very large scale tree planting programs and so on. All of these things are happening. But the argument here is we've got to understand what the impact of those things is, especially on inequalities, because quite often they can end up making inequalities worse. And I'm not going to go through this now because I'm running out of time. But yeah, we need to try and understand what these interventions might do in terms of population scale health inequalities. So to try and finish on a note, we've got a massive challenge on our hands. WHO say the environmental burden of disease is about 24% of all disease burden globally is associated with the environment. I think we can flip that on the head and say it's a massive opportunity. Most of that environmental burden of disease is modifiable through the way that we manage and tackle and deal with our environment and the ways we engage with it. So definitely an opportunity for us to grasp, hopefully. Thank you.
Thank you. A whole range of activity. We can open up to questions now. Anybody kick off questions? You have a question?
Hi, thanks for your talk. I was wanting to come back to that question that came up in the Dasgupta report, that a lot of the value in nature is difficult to measure because it's to deal with emotion or identity. And so my question is, does that mean we don't even try? Or are there ways that we should measure? And most importantly, how do we incorporate that in decision-making about how to allocate land use and perhaps prescribe green treatments?
Yeah, really important question. I don't think I know the answer to it. I mean, my colleagues who are economists tell me that there are lots of ways that you can turn these things that appear to be very intangible into real monetary value. I think people have big arguments about whether that should be done, and what's that whole thing, what's the economic value of a blue whale kind of thing. So I don't know is the answer, but I think it is really important. I think it's a really important part of the picture. I used to work with a great conservationist called Ken Norris, ecologist, and he stood up in front of a room and said, do you know what, we've been banging on for decades and decades for people to protect nature with moral arguments. It hasn't really worked very well. We need other arguments to make, and perhaps the economic and monetary arguments are part of that picture.
I remember when the great adverts for the seaside were all related to what was called ozone and fresh air. And I can visualize posters of somebody standing at the sea and breathing in. But you didn't mention a lot about air pollution. Is that because disease has changed in the UK? We no longer have so many miners and TB. And is there a change in the perception with the amount of disease or the type of disease to which a lot of people are subject?
Yeah, absolutely. There has been. So we've been through huge transitions in terms of what are the important diseases. So like you say, something like TB, we still have it, but it's nowhere near as critical as it has been in the past. Lots of other diseases have clearly changed. I think with something like air pollution, the characteristics have changed with it over time. So even as recently as the 50s, we had the London smogs and smogs elsewhere. We don't typically have those kind of air pollution episodes anymore, but we have other ones. In fact, like ozone, which is, invisible. You can't tell is that. Yeah, some people have regarded it as a positive thing for health. I don't know much about that. But I think that air pollution question it captures a lot. The world has changed around us, the environment has changed around us. The way that the environment impacts our health is radically different now to what it was even in the 50s. And this work has to account for that.
Yeah, thanks. It's a really interesting talk. I'd like to ask a bit more about the size of the effects, because the 2 billion figure was quite striking, but I imagine a lot of that is just the sheer number of people rather than individual effects being that significant. And in fact, the individual effects seem to me generally to be quite modest. And I suppose given that, it's how you make these difficult trade-off decisions. Do you spend more money on radiotherapy facilities versus more money on parks and trees? Do you invest in infrastructure, which probably can have a health benefit, jobs, incomes, versus the biodiversity that might destroy? Interested in how far we're getting with helping decision makers with those trade-offs. But the final point is, I thought your comment about global warming and carbon was really interesting, that we might actually start assessing these interventions not in terms of financial cost benefit, but in terms of their carbon footprint. So you wouldn't invest in high-tech medicine, radiotherapy facilities, or necessarily major infrastructure, because the carbon footprint of putting in more trees and more parks is far less. And I think that carbon aspect of cost benefit analysis is really interesting. Just wondering whether I picked you up right on that.
Yeah, I think you're probably right. I don't know a lot about it, but I guess, environmental economics for a long time has been concerned with externalities, as they would call them, things that they're not measuring. So presumably if you start putting carbon costs and benefits into these equations, the equations change quite a lot. So you're right. And that question about effect sizes is also really important. And this is fairly typical for a lot of studies. We typically see fairly small effect sizes relative to, so some of the BHPS work that we did, we're actually able to compare effect sizes. So I think one of the comparisons we made was for a certain increase in green space exposure, quite a substantial increase in green space exposure, it was, in terms of mental health benefit, equivalent to about 1/10 of the positive effect of having a job versus being unemployed. So we're realistic about what the scale of these kind of effects are. Having said that, we're talking about the potential for effect sizes that apply to very large populations. And so that's why, it's a multiplier effect. And I suppose this speaks to, I don't know if you're familiar with the Jeffrey Rose kind of argument around population health intervention. It's the argument that you've got a distribution of say, a health outcome. And in terms of intervening, you can either focus your effects on the people who are very high risk, say very high risk of cardiovascular disease, target them, intervene, try and shift them down, or you can try and shift the whole curve down. So this kind of stuff is mostly about trying to shift the whole curve down. But yeah, really important to recognize this in its context of all the other things that are really important drivers.
So thanks, that was really interesting. I just want to ask you a little bit more about the policy and the policy drivers in here. Partly because I think one of the issues, you put up the 25-year environment plan. It was heralded as the great, that's going to transform the way we deal with environment. That was 2018. Very little of that has been implemented. And I think one of the issues is the way that we deal with policy is it's very much in buckets. So we're talking here about health, the health sort of budget. We're talking about the infrastructure budget. We're talking about housing. All of these things are coming, charging down. We're about to, get this big housing policy change coming through. Has any work been done then by your team or other teams where they start to look at the stacked benefits? Because that's the information that's most needed rather than the either or. What is the additional benefit you get from building green infrastructure into or close to houses, close to population? So turning that question the other way around, because I thought the climate data that you had from Paris was really, really good. It was all it's excellent, but I just wonder where we're going to, what we need to do is start to provide solutions rather than trade-offs. And I just wonder whether or not that you seem to have the data that may be able to do that.
I think we've got bits of it. I think it's a really important point. I don't think we're there with it yet. And again, you know, projects say working with local authorities, the questions that come to us are literally like, what do we do? Let's say we're building a new residential development. We're going to put in, let's say, 30% of green space. How much of that should be public green space? How much should be gardens? What's the configuration that works best? I don't think we really know that yet. Probably not. Probably not. So, but I think we might as well at least have a go at sort of, you know, having an informed estimate of it. Because a lot of these things, you know, that like the 300 meters that we all use a lot in terms of do you live 300 meters away from a green space? It's not really evidence-based. It's based on what seems kind of reasonable based on all the evidence that we've got and having an understanding of how these things work. So I think there's merit in an evidence-informed estimate. I hesitate to call it a guess, but yeah. Yeah, you're right. So one project we did, so the Regreen project, I think we made a rod for our own back a little bit in trying to do that multiple valuation of different types of health benefit. I think because it's so complicated, we ended up valuing everything else in slightly different ways. So we couldn't kind of add it all up together. We could do a kind of a reasonably coherent narrative about the multiple benefits, but we couldn't convert it into a single number. And that might be a really useful thing to do.
Thanks, Ben, for your amazing talk. I have a question following on what being mentioned before, like a public health intervention and a two-way threshold. We're thinking from an environmental perspective, before Yamanda gonna throw some cabbage at me, I was thinking, do we maybe can testing the tipping point, as in 300-meter access to green space? That is a number. And then over a certain, like over 1 mile access to green space, there's no significant mental health benefits on that. Or it's like 3 trees in front of your house, it has some positive benefits, but 10 is too much. Is there kind of threshold maybe we can test on that? I think it's also, last time I heard about Jo talking about her research. I don't know how's the kind of final conclusion coming out now, but it's like for instance, the heat mitigation for that. Is that gonna be, so on the street, we're just gonna plant 5 trees around here, and they're gonna have much more mitigation for heat effects, for instance. And I think that's kind of like first line of questions. And the second line of questions, like for the UGBS, I mean, you kindly mentioned the coastal areas, like people swimming in the blue spaces. And then before I'm gonna be kicked out of the room, isn't that Natural England was talking about access to coastal and exposure to the inland water ponds is very different impacts on that, or it's like the access to the coastal area and your daily exposure to the kind of ponds in the park is kind of different. And then is there any lessons on how does the function of blue spaces differences to the health benefits on that end? Thank you.
Yeah, so I'll take the second bit first while I remember it. You're right, blue spaces are completely different from each other. And I think that's partly why a lot of the research we find equivocal findings, or different studies find different things, because what's beneficial in one kind of type of environment, coastal versus an inland waterway, might be really quite different. So I think there is a lot going on there. Sorry, you're gonna have to remind me the first bit now. Yeah, there might be, but I think the challenge is that the thresholds are going to be different for different people. So some of the stuff we were talking about this afternoon, so you know, the 300 meters might be fine for somebody who is, let's say, 28 and has a regular job and so on. For somebody who has 2 small toddlers, actually 300 meters might be too far away, might be 50 meters. It needs to be right outside, you know, the front door effectively for it to be beneficial. So I think that's the challenge with these thresholds. It's different if you're talking about trees and heat and stuff, because we can model that much better, right? And we're not dependent on access. Then it's much more sort of physical environmental sciences, and we can properly estimate impacts on cooling and stuff. That stuff then we can do, but I don't think we've got that level of detail yet.
I'll just take a one from online. So Lucy Jenkins asks about the role of connection to nature, particularly in schools and with children. Is there any evidence base about increased connection to nature in schools leading through to better outcomes?
We're having discussion about this this afternoon. Colleague who's much more expert on this than me. But yeah, I think there are various aspects of sort of nature interventions, and actually they've been going in schools for quite a long time. And not only education in schools, but outside of schools as well, with sort of forest schools and those types of interventions. And some of the stuff we were discussing this afternoon is the importance of a sort of acculturation with nature for kids, especially, you know, while you've got an audience which is effectively a very large proportion of the population in school, being able to work with them to think about how do they experience nature as a positive thing, as something they're comfortable with, and sort of evolving with it, may be really important.
Okay, great. There's a second online question. Are there any cases of direct community involvement in shaping environmental health policy? You have any examples?
I'm trying to think. There are. Find one off the top of my head. I'm going to cheat and take a very sort of micro scale example, but one that's proven to be really beneficial, which is as part of the Blue Health Project. One of the sort of small scale interventions they did was in Plymouth, a very small urban beach, effectively on Plymouth Sound, amongst quite a socioeconomically deprived community, and had an amount of community involvement in saying, okay, well, this is currently an area that's very scraggy, really not a very nice place to be, mostly parked cars and rubbish and stuff. So there was some working with the community then to say, well, okay, what would you want? What would actually work well for you? And actually what they ended up with was, yes, some natural environments and plant trees and so on, but actually a hard landscaped little amphitheatre that they could use down by the beach that was a really sort of felt like a welcoming space and was somewhere where they could put on events and stuff for the community, and actually just really completely transformed that on a really small scale for a relatively small community, but actually an intervention that cost a fairly small amount of money in the grand scheme of things. So that kind of immediate scale involvement, we've definitely seen the sort of benefits of that.
Right. Okay, there's a couple more questions. Anna?
Hi, thank you for the great talk. You mentioned the longitudinal study that you had. Has there been any research linking shifting baseline syndrome and self-reported feelings of green space, mental health, all of that over longer periods of time? Or is that like the longest time period you've been able to assess that and link that to possible like land use change, for instance, or change in habitat condition?
That's a great question. I don't think so, not that I'm aware of. It may have been done. Because I guess we do have a whole load of these cohorts around the world that have been going for a long time. Certainly here in the UK, we've had them frequently since at least the 50s, some before then. So you've got people who you can track for a long time. And that would be a really interesting thing to do, actually, to look at multiple cohorts and see if you could pick up that kind of shifting baseline. I guess the challenge is that we don't necessarily have the right data. If they had collected data for each of those cohorts throughout the life course, then we might start to be able to pin that down a bit. My guess is the data doesn't exist, but I could be proved wrong on that. But it's a really good point.
Thank you.
Thank you very much for your lecture. Very, very interesting. It just struck me, given the time of year, and you were talking about mental health, we just gone past, I think, what's perceived as the day for the worst mental health. So in your studies, do you take into account variables such as the time of year within the UK that can have quite an impact upon self-reporting, and indeed then perhaps policy, because doing stuff that's good in the summer may have less impact than in January?
Yeah, really good question. We do typically account for seasonality. So a lot of these studies, we will know when the person was interviewed or when they filled in the questionnaire or whatever, so we can account for that in our analyses. I think in the occasions we've actually looked at it specifically. In fact, say something like the 120 minutes per week study, that didn't, we sort of looked at it across different seasons, it didn't make any effect. So the same benefit was gained whichever season it was. I think there's a really interesting thing with seasonal patterns here and in other countries where there's large amounts of dog ownership, because my guess is, and I don't have any evidence for this at all, my guess is a larger proportion of the people who are out in nature frequently during the winter are dog owners. And like I said, their experience is probably quite different, and the impacts of it are quite different. So I think even just looking at seasonality, you've probably got multiple different things going on. Yeah, great point though.
Thanks, Ben. Yes, I just wanted to pick up on the dog walking point was prompting me. Are there any studies or any data comparing the benefits of, say, a more passive engagement with nature, such as perhaps just going for a walk and chatting to a mate at the same time, versus a more active engagement, such as gardening or conservation or bird watching or going for an all walk or something like that? I'm interested in what the mechanism might be.
Yeah,
What's the difference?
I think in terms of the analyses that we've done, say with that mini study, we typically would account for what type of activities people are doing. And when we look at those kind of fairly general mental health and well-being type outcomes, typically doesn't seem to make much difference. So the 120-minute study didn't matter what people were doing. They got the benefit appeared to be pretty much the same. Having said that, there may be an additionality, say with something like physical activity, because in that analysis, we've just kind of tried to wipe it out because we weren't interested in physical activity. What we didn't do, I don't think, is to bring these things together and say, are there additional other benefits? But I think, yeah, again, it depends on the outcome that you're looking at. So it's not a very clear answer. I don't know. But my guess is that, because you've also got a lot of self-selection in this as well, right? Because people who go for a run are people who like going for a run, and people who go and sit on a bench are people who like going and sitting on a bench. And I guess these observational studies were only able to just see what people are doing, and that's what people have chosen to do. I guess you can do studies where you randomize people to do different activities, but then you might be randomizing them to do something they really don't like doing. So it's one of those kind of may not be able to answer that question brilliantly, but it is important.
Yeah, thanks very much. I just had a quick question. You said there about it kind of matters on the outcome. And when we're talking about subjective well-being, is also often happiness or life satisfaction. I was just wondering whether your team or previous work had ever looked at how the relationship differed between different concepts of subjective well-being, thinking maybe the difference between these measures of pleasure and happiness and more hedonic ideas compared to the measures that are out there for identity, meaning, purpose. I'm not sure whether there's been any comparisons about whether there's a benefit for certain elements, but not others.
That's a great question. I guess, I mean, some stuff has definitely been done. So colleague Matt White led work, again, using the Meany study, but looking at different types of nature exposure and visit, and different, at least amongst those four key sort of ONS, OECD wellbeing outcomes, and definitely found different relationships between different types of exposure and the different wellbeing outcomes. As it goes for the wider different types of outcomes, I haven't really looked at that. It might be out there. I don't know.
Great, we're half past. I think we'll wrap up there. So thank you for your presentation.
Thanks very much.
Fascinating work. I look forward to some of the future work, particularly the wild swimming. It's very interesting what you find there. But we have drinks just around the corner, so feel free to linger, everyone, and have an informal chat and conversation as well. Thank you once again.
Thanks, Evinda. Thanks, Wendy.